So this is a tough one. Aggression and maladaptive behavior in the clinic. How do we deal with that? What do we do when our client aggresses towards us? Um, First, let's figure out, why does aggression happen? Aggression happens when a client, child, or person cannot communicate properly what they're trying to say effectively. So they kind of stem out and they begin to use aggression as a form of communication. Um, and it's not a wanted sign, but it does happen, and that's kind of what it is. The words cannot be found, so they are using their body parts to portray and to communicate. It's not okay, but it happens. um, what should we do when aggression occurs? I'm glad you asked. um, Redirection should begin immediately. Be aware of the precursors that happen prior to the aggression. Cease demands and high expectations during this time. A high expectation would be considered as a high expectation would be considered an attachment or SD or an SD discriminative stimulus should not be given during this time. It should be a high P, a high probability. Questions like clap hands, touch nose, touch head, stomp feet, something that is super easy for them to do should be given during this time. And that would be using your DRI or your DRA. Doing maladaptive behavior. So, like, if a client is kicking you, you can say feet on floor. That would be an incompatible behavior to a child lifting up their foot and kicking you, or you can have the child to stand up. If they are kicking you laying on the floor, if they are standing up while kicking you, you can just say feet on floor, and you want to make sure that you are giving make sure you're giving those commands to say, like, feet on floor. You want to be specific. You don't want to say stop kicking me, because that's not really directive or objective. You want to say feet on floor. And make sure you're keeping your space if you need to shuffle. And during these situations, you want to make sure that you are following your BSP, whatever is in there. If you are not familiar with your BSP, or if you have questions about your BSP or how to deal with their behavior, please reach out to your BCBA and let them know and communicate that properly. If you do not know what your clients like high P's are, which sometimes, I guess, I don't know, if you don't know what your clients' high P's are, which I guess that could be a thing, then you would simply, when aggression happens, you would block whatever hit. So if a kid is coming at you like this, put their hands by their side, and you would get behind the learner. You would guide them by their shoulders, not their hands or their arms, because you do not want to rip their shoulders out of joint. You would redirect them to another area, give them a choice of like two moderately preferred things, or you can choose them. Sometimes you have to, when behaviors are happening, we want to do forced choice. If you have a child that is very communicative, during the behavior, you can get them to choose like the book or something like that, or you can forcefully choose like the book, and or forcefully choose the puzzle and say, oh, put elephant in, put giraffe in, do this one. And then you can kind of, if you see them just trying to complete it on their own, let them complete a few on their own, and then you can say, okay, put parent in. And then that way you're kind of still gaining instructional control, and you're allowing them, and you're seeing that, okay, they're following through. Following through is a big thing. And it will definitely help when you are having a client who is pretty escalated and you're trying to get them de-escalated. Sometimes once you're finished with that puzzle, they may not be completely de-escalated. Okay, so now we're gonna go to the blocks. We're gonna stack the blocks. What if they knock the block over? It's okay. Stack. If you want them to stack red, and then stack green, stack purple, stack yellow, stack this, stack this. Oh, we're gonna put them away, and either depending on who your client is, you can put them away or have someone else put them away. Sometimes you can do pop it, but I don't know. Sometimes the pop it noise could be like a pop it book. The pop it noise could be too much for them. It could cause them to go off into another behavior. So if that's something that happens, you want to go get back in there and you want to find something else that you can get them to do. And basically, you're trying to get them to follow tasks. You want to be mindful during this time. You want to see, okay, if while I am doing this, what are the changes of behavior that are happening during this time? Do you see that the client is starting to calm down? Do you see that the client is starting to follow through? If while the client is screaming to the top of their lungs, are they able to still follow through with task demands? Sometimes during this time you want to implement calm down procedures like walking. Sometimes your client just needs to see a different face. Sometimes you may need to take a break, and your BCBA can kind of take over with the de-escalation process, and you can go take a breather, come back, try again. Because sometimes it's just the person, and then you will have to just go back and repair. You always want to be aware of what the function behind the behavior is. You want to be aware of what is reinforcing the behavior. You want to be aware of your environment, who is around you. You want to be aware. Sometimes you may have to move your kiddo to a room to where no one is, and then move the stuff so that they cannot destroy your clinic or your environment or your house or wherever they are.